I'm Dr. B. Harding. This is the Maxillofacial and Oral Surgery Department, University of Western Cape, Faculty of Dentistry. Here, basically, we have two sites. This is the Mitchell's Plain site, where we teach our undergrad students in this particular clinic. Okay, we will see our third year, fourth year, fifth year dental students, as well as our oral hygiene students. In terms of what we do service rendering to patients who come in for dental extractions mostly. It's not to say that is all we do, but our undergrad students from third year through to fifth year will do basic dental extractions as well as surgical removal of impacted teeth. We have a theatre facility which is now not run here, but it's at our other site. So anything which we cannot handle here, we may refer to our Tygerberg site, and either our consultants or our registrars will see the patients on that side. In terms of the numbers which we see here, it varies depending on the time of the year, because really our students manage a big load of the patients who are seen at this clinic. So for example, if it's January, our numbers will be a little bit lower because our students start usually late January. And then December we don't have students either. But on average, I would say that we see approximately 400, 450 patients per month. That's patients, that's heads, feet that come in, as we say, bums on the chair. But in terms of numbers of teeth extracted, there we're looking at over 1,000 per month, which is not really a good thing that we, but in terms of managing sepsis and so forth, it does alleviate pain to patients. Look, restorative is our main, we actually teach our students, the aim is to save a tooth or to restore function. So yes, by the time we see patients here, in this particular clinic, they've gone through a process of screening. At screening, they will then be directed to either having the tooth restored or the patients who come in for dentures. But by the time they hit this clinic, it's mostly extractions. I would say 98% of the time we are going to extract. If it is for facial pain, it may not be a case where we will extract. It may be a joint problem, okay, and that may end up as a surgical case or a prosthetic case. But 98% of the patients who end up in this clinic will leave without one or two teeth. The program functions such that this type of work is quite invasive. So it's really from our third year students, the dental students, where they enter this clinic. And that would be in the second semester. So if we look at our third year dentistry, fourth year and fifth year dentistry students, you're looking at approximately 250 students. With regard to the oral hygiene students, they enter the clinic in their second year of training. So no, they don't extract teeth, but they do anesthetize patients. So it's in this department where they have the opportunity to anesthetize the patient and assist with other surgical procedures.